Hi, my name is Eva Steiner, and this is my project Psychotherapists Around the Globe. I am interviewing the psychotherapists around the world and asking them the same 8 questions. I am wondering how mental health profession is in their country. Today we are going to... So before we start, can you tell me a little bit about yourself?
Good day to you. And first of all, I'm glad to be here to share some insights as a psychologist, as a therapist from Guyana, South America. And myself, my name is Anju Vivekanandaraj. I'm a licensed clinical psychologist. And I'm also founder of Inner Peace Psychotherapy and Counseling Services, which is my private practice. And I also work as a consultant psychologist with different other hospitals and clinics here in Guyana.
Okay, so tell me a little bit about your culture. What is some holiday or tradition that your country celebrates? And if your culture would be an emotion, what emotion would it be?
Guyana is a place of mixed cultures. So we have different varied cultures here because Guyana is a place of different ethnic groups. So we have Indians, Africans, Portuguese, and Europeans who came here to Guyana during the earlier periods of colonialism. But we also have the Amerindians, who are the indigenous people of Guyana. So we have different ethnic groups, and with it comes the different cultures and its own traditions here. So it's really an interesting and an exciting place to be in Guyana with these different cultures, and you get to experience all those different cultures here. I would say the holidays, as you mentioned, we just had recently 54th Republic Day celebrated in Guyana. So we celebrate the Republic Day every year on February 23rd. And so we also call the Republic Day as Mashramani. So basically this word means, it's a celebration after hard work. So it is a day where you would see a lot of parade happening, carnival. So I'm sure many would be familiar with the carnivals in South America. So here in Guyana, we have these carnivals happening on the Republic Day. And apart from that, we have Easter holidays, Easter celebration. We have Pagwa or Holi, which is similar to the Indian Holi celebration that we have here. And followed by that, we have Indian Arrival Days. It's the day where we celebrate and we stress the day when the Indians came here or arrived in Guyana for the first time. And the other holidays include Diwali, again, which is the Festival of Lights, which is similar to India. So we have the similar celebration here. And in September, we have the Amerindian Heritage Month. We celebrate everything about them, their culture, their food, their contribution to the society and the community, their craft works. So everything about Amerindians is celebrated during the month of September. And we have the Christmas celebration. So it's a lot. So as you could see, it's a mix of different festivals and celebrations coming from different cultures too. And the good thing about here being in Guyana is I haven't seen any biases or differences based on religion when it comes to, celebrating a Christmas or when it comes to celebrating Diwali. It's nothing religious based. You would see every people when it's a time for Christmas, you would see the whole Guyana in a Christmas festive mood. So everyone, decorate their houses. They get into that mood of Christmas and holidays. And again, when you see the Diwali, again, it doesn't mean it is nothing Hindu-based celebration. You would see every people coming in together. So it's that sense of unity, a sense of celebration when it comes to the different festivals and the holidays that we have here in Guyana. So that's a beauty that you could see and experience being here. Yes, with the emotions, I would say the emotions related to culture here would be a sense of belonging. As I mentioned, everyone are united in different ways when it comes to these celebrations and different aspects of culture. Everyone share that experience. So there is that sense of belonging, togetherness, and also I would say a sense of excitement. So excitement also because Guyana is presently a happening place. There's a lot of growth, a lot of economy development and growth happening. So it's much more looking forward to the future and all those growth and development that comes with it. So I would say it's a place right now which is much more exciting. There's a lot of excitement going on, and there is also that sense of belonging in this country.
And how big is Guyana? How many people are living together?
The Guyana is really a huge country, but a major portion of the country is occupied by the rainforest. And when you look at the land or the place it is being inhabited by the people, I would say it's a bit smaller. So we have a population of about 800,000 people in Guyana. The central part, which is the capital city, the Georgetown, which comes under the Region 4, is one of the, how can I say, much more of a happening place. But we have so many other regions which are much more remote and interior or at the hinterland.
It's really nice to see how all the cultures actually came together, and like you described the holidays, it's like from all the culture combined throughout the year.
Yes, and everyone brought with them their own culture, their own traditions, which has kind of shaped things over the years. Like, still you could see differences, like when it comes to certain aspects of, for example, an Indian culture, you would see that there is differences because it's something that has been shaped over the years. Even though the holidays are similar, even though you could see certain cultural aspects and values that are followed here similar to back in India, you would say that it has kind of shaped it in its own way.
How did you become a psychotherapist in your country, and what is your psychotherapeutic approach?
My educational background is all from India, right from my schooling and my higher educations, the university level educations are all from India. So I'm here in Guyana for the last 6 years, and I have been practicing over the last 4 years in Guyana. So once you're here in this country to be practicing as a therapist or a psychologist or as a psychotherapist, you need to be licensed. And the licensing body for us here in this country is Allied Health Professional Council of Guyana. So the Allied Health Council is a licensing body. So basically you have to have your required educational qualifications, your clinical trainings. So you submit them and they approve and they give you the licensure to practice here in Guyana. The therapeutic approaches, I would say I'm a person who uses different therapeutic approach based on client needs. So I don't stick to one specific therapeutic approach. So I would say I'm more of a person who uses integrative therapeutic approach. But the most widely used approaches would be mostly cognitive behavior therapy, especially I would say the ACT, the acceptance and commitment therapy. I use that a lot in my practice, along with mindfulness-based CBT. And also I use EMDR, clinical hypnosis, and I'm also a certified EQ practitioner, NLP practitioner, and mindfulness trainer. So I derive different approaches from all the other areas. Basically, I look at the individual client needs and think of what therapeutic approach might best suit them.
And do you maybe know in Guyana, you also go through Bachelor of Psychology and then, I don't know, clinical psychology training, and then you are allowed to practice as a therapist? Or is there any other way?
Yes, we definitely do need to have bachelor's in psychology, followed by you can do your master's, and that could be a specialty in different field, like in terms of it could be a general psychology or clinical psychology or developmental psychology or forensic psychology. So definitely the route to becoming a therapist is you can go with a bachelor's in psychology followed by a master's. There are also other ways, meaning the other options where people can be changing their career path from different other medical and healthcare fields. So a medical doctor, again, they can do their psychology related higher educations and become or practice even as a psychologist. So there are those options too. But when you consider the education in Guyana, in psychology, I would say it's very limited because we recently have the psychology degree program being started with, which we call as the University of Guyana. So that's the university, the major university in Guyana, which is a public university. So they have the bachelor's and master's program. Then we also have something called as the Goal Academy. So this is basically a recent initiative done by the government in Guyana where they're offering different programs, not just psychology. And this is basically different universities from different parts of the world, different countries. So they become partnered with this Goal Academy and they're offering their programs online to the people in Guyana. The good thing about this program, the Goal Academy and its programs, is it's offered free for citizens in Guyana. Because as I said, we have limited universities and educational institutes here in Guyana. So this gives a wider opportunity and wider options for people to pursue different courses and different degrees that they wanted to pursue. So again, we have a few universities offering psychology programs, but not necessarily on a clinical basis. It's not a clinical program because again, a clinical program needs to be in person or on campus with the clinical trainings. So we do have psychology programs that are much more like a organizational based psychology. So these are some of the avenues that we have in Guyana to pursue psychology related education.
And how is regarding psychotherapeutic approaches? Do you need to travel outside of the country and gain education regarding the approach, or you have some approaches available also in Guyana?
When it comes to the specific psychotherapeutic approaches, for example, my PhD is in psychotherapy. I do that outside with University of Central Nicaragua. So when it comes to the specialized programs, definitely, we have to approach outside of Guyana with, it could be online based or different countries. So still we haven't reached that place of offering specialized programs.
How society looks upon psychotherapy or any psychological help?
It's still stigmatized word and it is still stigmatized in this community and society. So it comes with a lot of concerns when you think of getting any form of psychological help in the society. So there is that concern of being judged. These are some of the words that you can hear from people here is, I'm afraid to talk about my emotional challenges or issues that I might be going through. I'm afraid that I might be termed crazy, or I'm afraid that, or I'm concerned that, they might think that something is wrong with me. So coming to therapy is not something that is seen as, it's not necessarily that you should be having some kind of a mental health condition or a disorder for you to come and see a therapist. It could be simple as you're just feeling stuck, you needed a different perspective, you just don't know what is the next step forward in your life. It could be simple things, but it's always seen in a different way in the society. So there is also a difficulty when it comes to talking about your problems or sharing your emotional problems and issues with your family and friends here too. So an individual might have their necessary support system in life. They might have their friends, they might have their parents or siblings, but they don't want to talk about it. Again, because there is a fear of the confidentiality aspects, like my information being shared around. Like I don't want other people in my family to know about what I'm dealing with. So they don't want to talk about it. Because you could see this happening in certain families where you tell your mom, all right, a child might feel that he or she is having a problem. They're going and talking about it. So as a mother, what they feel is like, sometimes they feel helpless. They don't know how to deal with this, how to help the child. So they immediately, they go talk about it with an aunt or an uncle. And that's how the information gets shared. So there's that concern and fear of my information being shared. And I don't want that to be discussed with my friends and families. And there is that fear and concern of being judged following that. And when it comes to reaching out for a professional help, again, there is those concerns about how people are going to see me. If they know that I'm going for a therapy session, how are they going to judge me? There is also a fear of confidentiality. Again, people, they don't know how well the therapy sessions are going to be confidential, So there's that big question about that. And I have also heard people say they're not aware of who are the people available here? Who are the professionals available here in this community? I feel like I need some help, but I don't know who to reach to. I don't know where should I go. There's also a confusion about should I be going to a psychologist or should I be going to a psychiatrist? So people need more awareness and education on what are the mental health resources, what is the difference between psychologist and a psychiatrist, who should you be going to. Yes, so these questions and the stigma and the concerns kind of limit people from reaching out for help. So there is a huge difference from a person recognizing the need for help and taking that step to come forward. And it usually takes a lot of courage, despite the stigma in the society or not, it takes a lot of courage to step forward and to talk about what is that they're going through, to accept that they need the help. So it takes a lot. But it's on another level of difficulty here in the society because of these concerns and the lack of awareness.
Okay, I have two questions regarding this. First is, as a therapist, how hard is then to get the clients? And the second is how the therapy help is accessible through private system or through public health system?
So we have different resources here in Guyana to address the mental health issues. So on a public level, we have, the mental health unit, so which comes under the public hospital or the public healthcare system, and they have the qualified and trained professionals offering different services, not just the counseling or therapy sessions, but also on research level of interventions are going on with the mental health unit. Then we have different other psychologists and psychiatrists operating at the public hospital, so which is the Georgetown Public Hospital here in Guyana. And we also have few private practitioners. And when you look at the private practitioners, it's not just a private practice for themselves. It's not just an individual private practice. Most of them operate on a different level. Some of them, they do operate on both public and private practice. So they have their own private practice and they might also work with the public system. And there are other therapists who operate just on a private level with private hospitals and their own private practice. And also we have other emergency helplines that are established specifically for dealing with suicide or self-harm related issues. We also have a helpline that is operated on domestic violence, gender-based violence and domestic violence issues that people can reach out to in terms of emergency. So these are some of the mental health resources that are being established on a public level. And on a private level, I would say it's very limited in terms of a private, mental health resources.
So what is your society teaching about child-parent relationship, and whether these values of society also influence how you design your interventions as a therapist?
There's both an individual difference and also a culture-based difference. So as I mentioned earlier, Guyana is a place of mixed culture. So we have the Indian family traditions, we have the African family traditions. So there's those differences that comes into play when it's defining the child-parent relationship and how significant that is. And there's also going to be a difference from one family to another family also. But overall, I would say the child-parent relationship is very much valued here in Guyana. From family to family, from culture to culture, it's still a significant relationship that's being seen. And so it is seen there until the person reaches a level of independency as they become self-supporting. Till then you would see that there is that strong importance that is placed in terms of a child-parent relationships. So definitely, coming to a therapy session, a person who is coming to a therapy session, and if they are under 18, they definitely need a consent from their parent or a guardian to be there in terms of the session. So in my approach, I would say that when a person who is under 18 is coming to a session, the informed consent is needed from both the child and also from the parent, especially the parent and guardian has to sign the consent. And a general involvement is needed during the sessions when we are dealing with individuals under 18. So it's again depending on what is the individual's problem, what are the challenges. So when and where it is needed, a family member is involved. Sometimes the whole family needs to be there. Sometimes it is just one of the parent. But an update is always given to the parent regarding the progress of the child. And if there is anything important, especially if the child is of risk to themselves, a risk or danger to themselves and others, then those aspects are definitely informed. But otherwise the specifics of information that might be discussed with the child, that remains completely confidential in terms of the therapy. So it definitely shapes the therapeutic intervention that we do when it comes to a child under 18, yes. But once they become an adult, that's completely different. That is up to them. They have a complete option to give consent and do their own sessions. And even though it might be needed at some point, we might suggest, okay, we feel like you needed to have your parent in the session. Maybe you needed to work on certain aspects of your relationship with your parent. Still, it is up to the adult to decide whether they wanted to go with it or not. So there's those differences. And something specific that I would like to state is I have seen kids like about starting into 18 and 19, the early adulthood phase. They come forward to sessions by themselves, and they say that I wanted help, right? I recognize that I'm going through a certain set of challenges. I wanted help. I came forward by myself, and I wanted to do this for myself. And so they paid. So when you question them about the financial support, so where is the financial support coming from for your sessions? No, I'm saving it out of my the pocket money or whatever that you get. I'm saving it, and I can support myself. So at that point, it's more like a critical line. Even though they are, legally considered as adult being after 80, right? And still they say that they can support themselves, and they wanted to do it for themselves, and they don't want their mom or anyone to know about it. This is something I want. Again, the concerns come back into play at that point, because they don't want them to know, because they are worried how the parents is going to see it, how they're going to treat it. Some kids are worried that they don't want to burden their parents with these information of what they're going through. So because of this, so you would see few of them approaching therapy in that point, when they know that, okay, now is the time that I can do it for myself.
What are the learned beliefs regarding client-therapist relationship, and can the relationship continue outside the therapy once the therapy process is over?
I would say that needs to be in a professional sense. And definitely there should be clear set boundaries established right from the beginning of the initial session. And sometimes that needs to be explained, to clarify for the other person, for your client or for your patient. You need to clarify what that means. And again, I would say there is an individual differences. So despite being completely professional, completely, within the boundaries and within the limitations of as a client and the therapist relationship, there can also be individual differences in terms of from one therapist to therapist. So when I say that, for example, again, I cannot talk in a generalized way for other therapists here. When I say those individual differences, for example, I always tell my patients that, yes, we meet during the session, right? But after the session, before we meet the next time, there could be moments where it's a critical moment for them, right? It could be an emergent situation, especially dealing with suicidal thoughts and self-harm behaviors. So I tell them, if it's really an emergency, yes, we do discuss all the emergency plan. We develop all the ideas of who to reach out, who would be the best person to reach out, and who's the next person if one person is not available. Despite that, sometimes we may not know how the situation is for each and every individual. So if it is really an emergent situation, I always tell them, don't hesitate, call, right? Call. But again, it is all within the defined boundaries and limitations, professional boundaries and limitations as a patient and a therapist. But I'm a person who's open to that. Okay, if it's an emergency, reach out. That's not a problem. And we have other therapists here who might feel differently, like they don't want to be disturbed, because sometimes it can become overwhelming. Like when you say you're okay to, reach out. For some, that can become overwhelming when persons reach out outside of those therapy hours. Again, the therapists, they have their own life, they have their own personal things to deal with on a day-to-day basis. So some persons might not be open to that. Some persons might be very strict with only connecting and talking during a session. So there's that individual difference. But apart from that, I would say definitely it needs to be completely professional. And sometimes you needed to also note for any kind of a transference happening in terms of a client-patient relationship. And if needed, you have to, clarify further for the persons what this therapeutic relationship means. But personally, I haven't had any issues in terms of a client-patient relationship. It's always been clear from the beginning. And my clients have always respected those professional boundaries. So that's something that we needed to focus from early on. So that is well established, and it is also practice. And that practice comes from both the therapist and from the patient. It's not something we can just, give out the information and expect that the person gets it and they follows that, right? And as a therapist, when you maintain your own professional boundaries, I would say naturally that is conveyed in an indirect way to the person too, the other client too. So that is something that needs to be practiced on a more consistent basis.
And is supervision a must for a therapist in your country?
I would say yes, supervision is must. And again, as I mentioned earlier, my educational background is from India. So it's I could say more based on there compared to here. And here, as I said, it's been only a few recent years over the last 3 years that we have started with psychology programs in the university here locally. But definitely a supervised clinical hours is a must to become efficient and ethical and professionally trained therapist.
And in a case of therapeutic abuse, do you have any organization where the client can go and file the complaint?
So as I said, the licensing body here is only one that we have, which is the Allied Health Professional Council. So all the allied health professions comes under that. So not just the psychology, whether that's the the nursing or physiotherapy, every allied health council, it is licensed by them. So when you have any issues with regards to this particular services offered by any professional, then usually the complaints would be directed towards them. And on a government level, we also have the Ministry of Health, so which is responsible for all healthcare related services in Guyana. So again, that would also be another place which could be approached for any complaints regarding any of the psychological services that is being provided.
What are the most common complaints that the client comes to therapy for?
We have a lot of depression, so that's a much more of a prevalent mental health issue. Depression, anxiety, again, different types of anxieties and phobias. We have OCD, and also I would like to stress that the trauma is also a big part of the mental health issues that we could see because of the dysfunctional family system that they would have grown up in, and the past, abusive experiences, abuse in many different ways. Then there is also a lot of domestic violence issues. So these are very common psychological issues that you would see people approaching with. And apart from that, yes, we have also relationship-based issues that can come about.
And if you would share one tool, belief, or approach that is a must-have for you as a therapist, what would that be?
This is personally my belief, which I always see that every one of us has our own innate abilities to deal with different challenges and difficulties in life. It doesn't mean like, we don't know anything. Like, we have those resources within ourselves to deal with different difficulties and challenges. But sometimes, depending on what is that you're going through, we can be a lot overwhelmed. It could be a lot too much. And in those moments, we lose that sense of clarity. We find it difficult to access those resources and abilities that we might have. So it becomes a bit difficult. And so I believe, like, when a person comes to me, it's not me giving them those, always it's not about me trying to give those resources. It's also about more of a guidance, where I believe my role is to guide and help them to get back in touch with their own inner resources and inner abilities, so that they can better manage whatever the difficulties and challenges that they might be going through. So that is a belief that I hold on to as a therapist and has a role of a therapist. So yes, we might give additional tools and techniques during a therapy sessions, but it's also important that a person recognizes their own inner strength and resources. And that gives them the confidence to deal with future situations and difficulties when it comes across. They know that, I can do this. I also have my own resources that I can access to when needed. So that guidance is something that I believe is much more important, in addition to you teaching new techniques and tools.
Okay, so thank you for doing the interview with me.
Thank you so much. And thank you for having me.